Okay, guys, so let's start. Okay, so who can tell me what is the difference what is move one in the introductory part? We've talked about it during the lecture, so I want you to tell me what is move one, if you just, to refresh your memory. What does the move one in introduction do?
I think stating out the topic.
It's doing what, Joseph? Sorry?
I said I think it's stating out the topic.
It's stating out the topic. How? How is it stating out the topic, though? What is it doing?
It's still the introduction.
It is the introduction, but what is it doing? What is the purpose? Hmm? Of move one?
Focus, I think.
So what?
The first stage is to focus on the topic and grab the attention of the.
Guys, the first step, the first move, look, we've talked about it in this slide, in the introduction, is to introduce the importance of the topic to and explain how it is relevant to the field. Are we all dentists here? Medical students here? Dentists? Yeah?
No, not everybody is a dentist here.
But you all come from the medical field.
Yes.
Yes. Okay. Give me an example of some issue in medicine that you would be writing about.
Okay, well, I think for me, maybe the use of herbal medicine in this new age.
The what medicine?
The use of herbal medicine.
Herbal medicine.
Yes.
But how? To do what? You see the topic, the use of herbal medicine. It is very broad, okay? You need to narrow it down. Because herbal medicine can be treated for insomnia. Herbal medicine can be used for multiple sclerosis. Herbal medicine in what exactly?
Okay.
Give
I'll say
one
maybe for HIV treatment.
herbal medicine for HIV. Seriously?
Yeah, I just think some medications work for HIV. Maybe not totally cure it, but at least
Okay, so
suppress it.
your topic is using herbal medicine to treat, not cure,
Yes, not cure,
treat,
treat
yeah, treat
HIV.
HIV, right? In HIV, the use of herbal medicine in HIV treatment, something like that, yeah? That's
Yes,
what you
yes,
are going to be
exactly.
exploring,
Yes,
yeah?
yes.
The move one in this case would concern itself of how is it relevant to the field of medicine, your topic. If you were to write about something like, if you were to start with herbal medicine has been developed in 1990, in 1785 by Professor Rudolf Bauer when he needed to treat the wounds of a patient. However, it has developed ever since that, and blah 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 blah. Does it answer how it is important to the
No, I
field
don't
of
think so.
medicine?
No,
Hmm?
not yet. No.
No, it is not. So it does not answer. It just brings you the history of the topic. Yeah, but how would you make it answer the actual relevance to the field of medicine, the herbal medicine use in HIV?
Well, I can say herbal medicine in I think uh, herbal medicine has not been given the right focus or in this new
Um,
age or something. I don't know.
okay, now you see, you sound blaming a little bit. It's not being granted. If you want to sound professional, you need, remember we talked about these things in one of our lectures, that you don't want to, the fallacies, maybe you want to look through that slide a little bit. You don't want to sound judgmental, you don't want to sound you don't want to have a blaming tone, yeah, when you're writing. So maybe in terms like you could use something like as medicine develops and as medicine advances in today's world, as a scientific, together with the scientific advances, mm, herbal medicine has began to take its place in the medical field. Yeah,
Yes, you're right.
more and more people are concerning themselves with the use of not not traditional medicine. Yeah, something along those lines. Yeah, how many doctors are beginning to incorporate the herbal treatment into their drug treatment regimens. More and more research is being done on the use of herbal medicine in 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 treating various diseases, okay, because it's true. Yeah, I mean, look at the marijuana. Everybody's saying that many cancer patients are being prescribed marijuana to ease the pain and the joint and the stress and everything, even though it has a lot of negative effects. Still they're prescribing because it works really well to ease the symptoms of chemotherapy. And I'm sure there are other treatments that are available out there, yeah, to treat various diseases. Mm, Immunodeficiency. I know that there are a lot of treatments being done by vitamin introductions, and like nutrition is uh, taking its leading part in treatments today. But you see what I mean? Like, don't sound blaming, don't sound discriminating. Like, bring in your topic and show how it's relevant to the field of your expertise. Yeah.
Yes, sorry, one question. What about a topic like this? The treatment of glaucoma with the use of marijuana.
Sure. How would you answer that? Okay, how would you start your introduction? It's a very good topic, yeah. It's very specific because it's a very specific disease. and it's a very specific drug. I'm sure that there are other drugs. It's not just with marijuana that glaucoma is going to be treated. Other drugs are going to be introduced to its treatment, but you could talk about benefits, or you could talk about the disadvantages of using cannabidol products, yeah? Cannabinoid or whatever they called, I don't remember exactly.
Okay, thank you. I'll
Joseph?
try and work on that.
Okay, do you want to practice a little bit here? Because, I think, I feel that it's better that, you give it a try, and if I think that something needs to be corrected, I give you an advice. Yeah.
Yes.
Okay. Can you give me the first sentence of the move one of the introduction to your topic now? How would you go about it? Take your
What if I
time. It's okay.
marijuana treatments on no marijuana has been added to or marijuana was added in the recent years or in the past years for the treatment of glaucoma or the advantages of using marijuana to treat glaucoma. I don't know if
Um,
that's
that save the last bit for the later of the introduction, but the first one is very good. But instead of glaucoma, because the glaucoma is your actual, I'm going to talk about different moves because remember, we have four moves. So instead of saying glaucoma, you can say that marijuana use in medicine uh, marijuana is being used to treat various diseases in medicine, in modern medicine, okay? More and more research is being done into marijuana. And please do not use marijuana because marijuana is not a scientific term. It's called cannabis something, okay?
cannabis
Cannabis or
sativa.
something. It's either cannabidol or um, there is a scientific
Sativa. I
medical
think sativa.
sativa.
Yes, I think. I'm not sure.
Okay, research that, look into that, okay? Because we want to sound professional and we want to sound academic and we want to sound not like we are writing a term paper for seventh grade. You're a doctor. You should know all this, okay? So try to use medical terms in your research, okay? So at the beginning, you should be vague. You are introducing the concept, okay? You're not introducing your, you're introducing the cannabis sativa. Good. Mm-hmm. So be a little bit broad, be a little bit how cannabis is done in medicine, but you don't have to elaborate. What you're elaborating is how it's done to treat glaucoma. But when you introduce the subject, you introduce it, the first sentence, the first maybe two sentences, you are describing how marijuana is used in the field of medicine, okay? Not in treating uh, glaucoma, but in medicine. You will do that in the second move, which is a focus, okay? So in the second move of your introduction, you are talking about different definitions. What is the marijuana treatment defined in, like in medicine? How is it defined? What has previous research shown? Obviously that it's effective in, but also maybe ineffective. Yeah. How is it developed so far? What are the advances of using cannabis in treating glaucoma? Are we talking about like glaucoma? Am I still on the uh yeah?
Yes.
So uh your second part of your introduction is your focus, okay? And make sure you are able to distinguish that, yeah? Do you guys understand what I'm saying? Okay. Um, the third the third move of your introduction. Remember, this is the introduction, okay? The third move is the important move, because in third move you are basically um, introducing how you are going to structure your argument, how you intend to answer your question. Okay? So, how would you do that, Joseph? Somebody, please, let's start a conversation here. How would you go about this? How would you, if we stay on the cannabis sativa subject, how would you answer the question? What would you say? What would your words be?
You said we don't have to mention the glaucoma at the first stage, right?
No, you don't have to. But this is the time when when you mention it. Okay, here you mention it. In the second move, you mention it, and here you explain how you're gonna answer the question, what you're gonna talk about. So this work is going to examine the benefits of cannabis sativa use in treating the glaucoma. It's going to focus on the okay. Very good, Joseph. Yeah. This what you just wrote me, this what you just wrote me is perfect for move 1. Okay? This is perfect move 1. This is not move 3 though. This is perfect move 1, but it's not move 3. In move 3, you would talk about this work is going to focus about the use of marijuana in the treatment of glaucoma. It is going to examine how all of the long-term benefits of the treatment and whatever else it has. I absolutely have no idea. Yeah?
Yes, so I think what if the second stage you talk about glaucoma itself before introducing the usage of C.
It what you just wrote me. Many patients inquire about the use of marijuana for their uncontrolled glaucoma, especially in the setting of increased legislation in many states. It is good for now that I'm thinking about it. It is good for the move one. However, um, it's not really talking about. You will need to expand a little bit more to get to the point. Yeah.
Yes,
So in Uh, but this is definitely good. You're on the right track. You just need to practice a little bit, okay? And we'll get there, I promise you. So the third one is actually what you're gonna be talking about in your essay. Yeah, exactly. What are you gonna be talking about? Are you gonna be talking about the process of how the treatment plans? Are you gonna be talking about the research advancements? What is it exactly that you're gonna say? Yeah, and in the fourth you're going to talk about the answer to your question. Are you going to say that is it good at the end of your essay that it's actually beneficial? Are you going to say that no, it's not beneficial in the long run? It is beneficial short term, but in the long run, let's say people start developing a lot of side effects, and it is not recommended. Or what is your point gonna be? The final decision, yeah? Or whether you're gonna say that it's up to the doctor or it's up to the patient to decide what approach they're gonna take. So yeah, that is pretty much the four moves that I will cover. Is it effective? All of that, exactly. Mm-hmm. And this is all in your introduction, okay? It is not your essay. It is your only your introduction. Good? Okay, guys. I think this is it then for today. I'm gonna stop. And